One of the hardest, cruelest parts of all this is burying the dead, and the fact that social distancing rules mean hardly anyone can attend a funeral now. Maybe 10 people at most, all 2 metres apart. Cremations are closed to the public. Only a small number of mourners are allowed at graveside burials. Some funerals are now being streamed online. Our island correspondent Emma Vardy reports.
The last time I seen her was when she was being put into the ambulance. It's heartbreaking. It's just heartbreaking. I wouldn't wish it on anyone.
No church service, only a prayer at the graveside for Anne Best from Fermanagh, who died after contracting coronavirus. Despite a lifetime together, her husband of 51 years, Tom, now in isolation, was unable to be with her at the end.
I said to myself, I'm going to break all the rules and walk up there and say you're buried, but I'm not going to do that because it would be selfish on the other people.
At least now they're together and they're not suffering anymore, you know, or in pain, so that's the main thing.
Quarantine is a lonely place to grieve.
I'll put you on speaker. Can you hear me okay there?
I can hear you. Yeah, I can hear you.
We reached out to Fiona in Belfast. On the weekend, both her mother and father died from the virus within hours of each other.
We held their hands and we're hoping, even though they weren't conscious, we're hoping that they could hear us and knew that we were there. We got to say at least goodbye, which we know a lot of families and, you know, haven't had that chance.
Her mother, Isabel, will be buried, but her father, Christopher, known as Artie, wished to be cremated, which will have to take place without any family there.
We can't even do the normal in Ireland awake, and, you know, my parents would, you know, my mum would love this, you know, and my dad would love a big celebration, playing Elvis.
And why did you want to share this?
This is something I would never ever normally do, but I want to do it for their memory and also to raise awareness about how real and serious this is, because, you know, they're not just a statistic anymore. It is heartbreaking for all our family.
And nobody's able to do the natural things they'd want to reach out and do.
That everyone just, we're all just in our houses, you know, all trying to stay, you know, safe. And it's just it's hard enough losing both your parents, especially so close together. But then you can't do the normal process, and you can't, you know. So yeah, it is very, very hard.
Normally, in Northern Ireland, large funerals are a common sight, so the restrictions feel all the more stark. No more than 10 people can be at a graveside, and with mourners still compelled to socially distance, it's changing the way we're able to grieve. Those who stand beside the bereaved must ensure restrictions are respected.
None of us want to do this. We want to assist our bereaved families. We don't want to get to the stage where it's just going to be us and the grave diggers and the minister at the graveside. It's a hard conversation to have, but I mean, we feel as funeral directors we can still stand together with the bereaved and help them through it in a dignified and most respectful manner that we've done for years.
Mourning the dead is often said to be as much about a celebration of life. And many people who've lost someone during this time are hoping to arrange more fitting services for their loved ones when the restrictions have passed. But right now, the full grieving process is on hold. Emma Vardy, BBC News, Belfast.
The Business Secretary, Alok Sharma, has given a warning to banks after many small and medium-sized firms said they couldn't get one of the emergency loans promised by the government. New research suggests nearly 1 million UK businesses are just weeks from going bust. Andy Verity reports.
It was billed as the government riding to the rescue of small businesses.
They can walk into their local bank branch next week and talk to somebody about the coronavirus business interruption loan that the government is guaranteeing.
But with many bank branches shut, many businesses can't get through to overstretched contact centres. Thousands of firms have been turned down for a business interruption loan, while others, like this normally thriving Nottingham-based engineering firm, have been told they have to apply for a normal loan first, a process which may take weeks.
At the moment, I think too much control has been given to the banks and the lenders, the approved lenders, to make this happen. And I think it's still chaotic out there. It seems to be that if you're lucky, you're banking with the right party. If you're not lucky, you'll end up having to close your business.
An accountancy network serving 12,000 firms found that in spite of emergency measures, 18% of firms either probably or definitely won't get the cash they need to survive a 4-week shutdown. And if it lasts 12 weeks, that jumps to 32%. The problem for stricken businesses is that they're being expected to borrow their way through this cash flow crisis in a way that leaves all the risks with the business owner. Even if they can get a business interruption loan, the guarantees protect not the business, but the bank. And if, like many, they can't get one, the directors have to sign personal guarantees. And that means if the loan isn't repaid, they could lose almost everything. Today, the government had this warning for banks.
It would be completely unacceptable if any banks were unfairly refusing funds to good businesses in financial difficulty. Just as the taxpayer stepped in to help the banks back in 2008, we will work with the banks to do everything they can to repay that favour.
UK Finance says banks urgently need clarity on the government's rules, and the Treasury is preparing to reshape its scheme by the end of the week. For up to 1 million small businesses on the brink, the need for cash is now. Andy Verity, BBC News.
In France, 38 seriously ill coronavirus patients have been transferred by high-speed train from Paris to less overwhelmed parts of the country. The army helped to relocate the patients who have been moved to Brittany. France is struggling to free up space in life support units, and the situation has become critical in the capital, where the number of beds in intensive care units is now almost at the same level as the number of patients. The number of coronavirus cases in the United States has now passed 200,000. More than 4,500 people have died, almost half of them in New York State. President Trump has told Americans they are in the midst of a great national trial, unlike any the US has faced before. Our North America editor John Sopel reports.
At this time of year, Central Park in New York would normally be getting ready for concerts and festivals. Instead, a massive field hospital is being built there to help alleviate an overburdened health system. In this state alone, there have been 2,000 deaths. America is shifting onto a war footing, and it's brought a dramatic change in tone from the president, now urgent and sombre.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
And if that didn't frighten the American people, this message today from the Vice President visiting essential workers surely would have done. He said that the US was on a path to follow the worst-hit country in Europe.
We think Italy may be the most comparable area to the United States at this point.
For the first time in this crisis, Donald Trump and his senior medical advisors seem to be marching in lockstep. But one area where Washington seems at odds with the rest of the country is on testing, on vital equipment. Here, the president says that everything is under control. That's not what you're hearing on the front line. Today, exhausted health workers across the US have been protesting outside hospitals at the lack of protective equipment. And those working inside say supplies are running low.
We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
And we're running out of equipment in the hospital. Nearly everybody coming to the emergency department has this, and we're getting completely overwhelmed.
If New York is the foretaste of what's coming to America, this is what's ahead. In the money capital of the richest country in the world, a forklift truck outside a hospital lifting corpses into the back of a refrigerated lorry. John Sopel, BBC News, Washington.